In the meantime, while you're heading out, if you're planning to get out there, we're finally really getting into more spring-like weather, and a lot of people are trying to soak up the sun really any chance they can get. It's a good reminder that we need to protect our skin, especially here in Colorado. And dermatologist Dr. Joe Cohen with About Skin Dermatology is here to help us out with that. Thanks for being here. Always good to see you.
Nice to see you.
Okay, so tomorrow is Melanoma Monday.
Yes.
And May is also Skin Cancer Awareness Month.
Yes, and the whole goal is for the American Academy of Dermatology and the Skin Cancer Foundation really to increase awareness about the dangers of significant sun exposure. We know that significant sun exposure does lead to an increased risk of having skin cancer, and that's not instantaneous. It's really cumulative. So we really need to incorporate safe sun practices for everyone long term.
We always remind people, especially for us Coloradans here, it's even more important for us to put on the sunscreen.
You know, we have over 300 days of sunshine, and with a high altitude, we have more ultraviolet penetration, and then really our outdoor lifestyles that put us outside here in Colorado for hours and hours at this altitude translates to a lot higher rates of skin cancer here.
And the reality of it is, if we don't protect our skin, this can possibly happen. I know you sent us some pictures of what to look for when it comes to skin cancer. What are some common types of skin cancer?
So basal cell carcinoma is the most common type of skin cancer. It's that lesion up to the left, which has a little red discoloration, little blood vessels on it. About 3 million cases of basal cell carcinoma happen each year in the United States. Squamous cell carcinoma is more concerning. That could spread. That is something that looks crusty and often scabs. And then, of course, melanoma is the pigmented lesion. And melanoma translates to one person in this country every hour dying of a melanoma. So it can be a very, very aggressive skin cancer. And early detection is very important.
And we talk about the fact that you should know your skin better than your doctor. I mean, you should know every mark on your skin. It's important to watch over that.
It is so important. And this is a slide of how to do a self-exam. So we need a full-length mirror and we need a handheld mirror. And we really can examine pretty much all of our skin. We do need a friend or a relative to look at the lower back and specific areas like that that are hard to reach. And we should feel our scalp and feel if we have any lumps or bumps or scabs,
Sure.
Especially something that's new or changing. So, you know, we have acronyms that apply more to pigmented lesions like A, B, C, D, E, something that is asymmetrical, something has border irregularities like we saw on the melanoma there, something has color variation within it, or diameter greater than the size of a pencil eraser head. But E is the new one, and E means evolving. And evolving means that something is changing. This is a slide of one of the treatments for basal cell or squamous cell called Mohs surgery. And Mohs surgery is a very high curate technique to look at the entire margin for basal cell and squamous cell carcinoma.
Real quickly, let's talk about prevention, which is very important. We know to look for sunblock with zinc in it, right? That's the most important, right?
You know, zinc and titanium are just great things to look for because you can find them off the shelf. You don't have to find them at some specialty place. Many sunscreens incorporate zinc and titanium, and importantly, it protects against UVB as well as UVA. And when people just look at that SPF number, that is specifically just ultraviolet B, and we know that ultraviolet rays in the A range actually lead to skin cancer and lead to a lot of sun damage changes like lines and wrinkles.
And you brought some samples. It's a good reminder. I always have some block around, just so you know, even during wintertime. I try to be good. All right. Thank you, Dr. Cohen. Always good to see you. For more information on About Skin Dermatology, go to our website, thedenverchannel.com, and click on that red TV button.